The United Nations International Children's Fund have called on women in the states to practice exclusive breastfeeding as the states have low adherence to the healthy practice. This was disclosed by the UNICEF Chief of Kaduna Field Office, Dr. Gerida Barkila, as the flag of the 2025 World Breastfeeding Week held at Primary Healthcare Tunga, Bitasarki Road. The reports. Speaking at the flag off of the 2025 World Breastfeeding Week, the Chief of Kaduna Field Office, Dr. Gerida Barkila, represented by health specialist Dr. Ahmed Suhu, said according to the multiple indicator cluster survey on exclusive breastfeeding practice shows that Niger State has low compliance to the healthy practice. He, however, commended the state government for being among the first states to approve paid maternity leave of 6 months, which he said will support mothers breastfeed successfully, thereby increasing the state indices level.
There are only 10 states in Nigeria that have approved this 6 months maternity leave for working women. And Niger State is one of these 10. So we are working to make sure that all 36 states will adopt this policy and will apply it. And like I told you, our advocacy is across. But like the theme of this year's World Breastfeeding Week, we said creating sustainable support systems. So this is also one of the support systems. Support from government, support at community levels, support from both executive and legislative arms, and support of the general public also entirely. Just so that all systems are in place to enable this exclusive breastfeeding. We are sure in Niger with this policy up and doing, when it is observed strictly, I mean working women will have the opportunity to breastfeed. And like we saw that the indices for breastfeeding currently is 15.7% for Niger, while at national it's 34%. So with policies such as this maternity leave policy, we hope that the breastfeeding rate will increase significantly.
While flagging off the week, the wife of Niger State Governor Hajia Fatima Bago notes that the importance of exclusive breastfeeding cannot be overemphasized, as it serves as nourishment for the child, prevention of diseases, and also serve as a family planning method for some women. She encouraged mothers to lactate their children exclusively for the first 6 months.
As the wife of the governor and a mother myself, I am a passionate advocate for exclusive breastfeeding. Through the office of the First Lady, I will continue to champion initiatives that promote mother and child health, advocate for policies that enable breastfeeding, and support programs that create safe and inclusive spaces for nursing mothers. I appeal to all stakeholders, employers, families, community leaders, and health professionals to play their part in ensuring that workplaces are breastfeeding friendly, that maternity leave is honored, and that lactation rooms become the norm, not the exception. Let us extend love, care, and guidance to all mothers, wherever they are.
Also, the team lead of UNICEF U-Report, Aisha Ndagi, said they have embarked on advocacy visits to various communities in Tunga Ward, Minna, to sensitize the women in the community on the benefits and importance of exclusive breastfeeding of a child for the first 6 months with only breast milk without water or any other food.
So we are here in these settlements to tell them the importance, because we're in the World Breastfeeding Week. So we are here to tell them about the importance of breastfeeding. One of the things that is most important is feeding the child in the first hour of delivery, which is very essential, so that because that's the first immunization the child is going to get. So that is the most important thing. And then we are here to also tell them about the exclusive breastfeeding for the first 6 months. The child doesn't need water, he doesn't need solid, he doesn't need any other food, because anything he needs is in the breast milk that he's going to take, which is the most important thing. And then thirdly and lastly, what we are here to do is just to tell them that every child needs to be breastfed for at least 2 years of their life, because giving the child enough breast milk is like investing in their own future, for their health and also their brain development. And then lastly, we are here to also tell them the importance of spreading the news, because those that are here are going to tell those that are not here, and then by doing that, it's like we have saved the coming generation.
In his remark, the Niger State Commissioner of Ministry for Primary Health Care, Dr. Dangana Ibrahim, represented by the Permanent Secretary of the Ministry, Dr. Mohammed Ghana, reiterated the state government's commitments towards ensuring a healthier future for women and children, said the state government has approved the 6-month maternity leave with pay for lactating mothers and 2 weeks paternity leave for fathers.
Executive Council has given it approval for the 6-month paid maternity leave for all pregnant women in Niger State. And it has been gazetted and it is already in practice. And this is done in order to strengthen the fact that we want everybody to practice exclusive breastfeeding, and for the women to have very good support in that first 6 months delivery. It's very important for the baby to grow well and for the baby to have proper breastfeeding.
The event also featured baby competition, where babies between the ages of 3 months to 1 year were evaluated based on weight, physical appearance, and immunization status, with baby Aliyu Hadar as the first position, weighing 11.5 kg.
I exclusively breastfed him for 6 months. Then after 6 months, I introduced him to other food. I feel delighted. I feel happy. My goal to other women is that they should also continue the process of practicing breastfeeding exclusively, because it has a lot of benefit and advantage when it comes to the child and even the mother as well.
Pamela Duma reporting for NSTV News.